Joined in the studio by chemical engineer and food safety expert Austen Museka to talk about their solution to this problem. And we understand it relies on DNA binding to test for food contamination. Well, it sounds like Greek to me. I'm not a scientist. What is DNA binding? Mr. Museka, good morning, and thank you very much for your time. We did hear the health minister, Dr. Aaron Motsoaledi, at pains to explain that, for example, it took very long to really nail this listeriosis outbreak down, and also they had problems in accessing data from private laboratories who took their time in handing it over to assist the public health officials in really pinpointing the source of the latest outbreak, which the World Health Organization, by the way, has described as the worst ever in our history. Now, you say you've got a new way of fast-tracking the discovery of listeriosis. Okay. Can you just share it with us?
Briefly. Thank you, Dan, for the question, and thank you for the opportunity. So briefly, to put it in summary, the big win of the technology is turnaround time. So for example, you're looking at having a results in 3 hours, or less than 24 hours, depending on what you call your matrix, which is the way you set up your samples. So in our case, where we had results after 2 weeks, the users themselves, which is the food industry themselves, the company could have had such an instrument and had results within 3 hours. Much more to add to the technology. Of course, it uses what you call DNA binding, the Greek part of it, but we have made it user-friendly. So anyone on site or at a different location can access the results, have them automated, have them spread around, sent to the people who are interested in the results. So we're looking at turnaround times of less than 8 hours, depending on the type of bacteria, of course. In Listeria, specifically for Listeria, we're looking at 18 hours. So it differs with the type of bacteria, the preparation which should be done. But now 18 hours, which is less than a day, is good enough, could have given us a lot of time to locate where the problem was.
So this test, this DNA binding test that you do, it tests food contamination.
Yes.
So it can pick up if a product has got some contamination.
Yes.
As an example, Listeria.
Yeah.
It could be Salmonella.
Exactly.
As an example.
Exactly.
Now, is it easy to use? Is it accessible?
Yeah, very easy to use, very accessible. So what we have done is we actually have the reagents pre-prepared, if I can use that term. So all one needs to do is get the sample. It can be a food sample itself, but remember the other parameter of control is the hygiene around the system, around the industry.
Yeah, because we've heard that poor hygiene was a major contributor
Yes.
to the latest listeriosis outbreak.
Yes, so you could actually take samples from your hygiene environments, you know, your drains, your cooling towers, all those things which are within your vicinity of the industry, and then use that sample, follow the matrix, and then because the reagents are already prepared, you just then have to extract the DNA, which is the gene binding we're talking about. And then you insert your sample into the disk, and then in less than 1 hour, you get a result.
So can this be used by laboratories, for example, public health, private health laboratories? Can it also be used by companies like Enterprise, for example?
Wow. Yeah, I would thank you. It's not an open system, it's open to the whole environment. So it can be used by companies specifically. We have companies in South Africa in a different phase, not in a different phase, in a different environment already using it. We have embraced the technology. So companies can use it, laboratories can use it, researchers can also use it. So it's quite an easy to use system. The big win about it is that now, like you're saying, it sounds like Greek, we have simplified the methodology. So that if I were to give you a test kit, you could try how you get a result.
So how come didn't you and your colleagues raise your hands last year and say, South Africa, we can assist to help you find it? Because we saw listeriosis outbreak killing people and infants and stuff over weeks and months. Why haven't we known about this?
Okay, just to give you some feedback, Dan, about 3 to 4 years ago, I actually had not a tour, a campaign. I invited, I wouldn't say names, and a lot of people so that they'd come to our site. And I had a campaign. Actually, it was basically for meat producers, and they know about the technology. About 2-3 weeks ago, or they were aware, but then, you know, as a business, maybe they were constrained in decision making. But just to let you know that we have done what we could have done to reach to the market. A couple of industries in South Africa are already using it.
And the public health sector, are you going to reach out to them now that we know the damage that listeriosis has done to our country?
Yes, we're working with the public health sector and some of the pedigree professors to have an embracing of the technology, because generally, maybe just to highlight, in Europe and the Americas, this is the way to go for meat testing. But in our case, we have taken a little bit of time. So industry then has to be made aware this is the way to go.
So hopefully somebody from the Department of National Health has been watching this interview.
Thank you.
And they might try and find where they can get hold of you. Thank you very much.
Thank you, Dan.
That's Austen Museka. He's a chemical engineer and a food safety expert, and the people he works with have found a way of quickly turning around testing for things like listeria to avoid outbreaks like we've seen recently in our country. Your weather.